Hello, welcome to today's segment on knee pain. My name is Brian Holloman, I'm with Brittany, and today we're going to help you understand what do you do if you have knee pain. A lot of times you have pain in the knee and it does not always mean that you have an injury in the knee. Sometimes it can be because muscle tension in the hip is too tight. Sometimes it can be from muscle tension in the lower extremities. But if you have some injury, arthritis, meniscus issues, we want to help you learn what you can do and how we can help you through cupping therapy with medical-based bodywork. One of the first things we're going to do today is put a little bit of topical cream on the tissue. This is going to help keep the tissue hydrated because when we start cupping, there's a lot of friction that builds up and we don't want to burn the skin tissue. So what we're going to do, I'm first going to go through and I'm going to palpate to know exactly what's going on with the knee. I would have already interviewed with Brittany to know exactly what movements are affected and what appropriate treatment would be applied. So one of the first things we're going to do is catch the lower portion of the knee. We're going to move to the inside, and then I'm going to move to the opposite outside part of the knee. Is the level of pressure acceptable? We're going to move to the top lateral portion, and I'm going to go ahead and close off this medial superior region. Next, we're going to come in to this lateral inferior. And how are you doing right now?
Good.
Are you feeling the pressure?
I feel the pressure.
What does it feel like?
Feels like, well, yeah, it feels just like pressure. It doesn't,
Okay.
It's not painful. It's definitely uncomfortable. And I can feel muscles wanting to release.
Okay, very good, very good. One of the things that I'm noticing is that there are areas that are getting really red and areas that are lighter red. That is showing me where we have injury at. So we're going to put one more cup on the kneecap. We're going to lift the patella, which is the bony part of the kneecap.
Feels really good, actually.
And this is feeling good for her. We're going to leave this for approximately 2 to 5 minutes, and then we're going to begin to remove cups. I'll let you see through here. We've cupped the outside. We've cupped the inside. I'm going to go ahead, because we do have some tension through here, I'm going to add just a couple of more cups through here. And I've got a little bit more injury here on this outer portion. And that got a little bit tender for her. Now you can begin to see how red the knee's getting. The knee's getting red because we are bringing blood and oxygen to this area.
So it feels like pressure overall, but now that they've been on for a few minutes, or for a few seconds, I can really pinpoint where's more tender. At first it was just my knee hurts, and now I can feel exactly this is more tender than this, and this is more tender than down.
Okay, good. So she's actually able to, from the tension that she's feeling, she can tell where the injuries are, and I can see them in the reflection of the color of the cups. So this helps you better understand cupping therapy and how it can be used to help you recover from knee pain or from what would be referred to as arthritis in the knee. So we're going to come in and begin to release these. show you some interesting characteristics that occur with cupping. With cupping, there will most of the time be cupping marks. Cupping marks are not bruises. Cupping marks are not bruises. Very important that you know that. They are cupping marks. So basically, if you have tension in the tissue that's real tight, it's stiff, so things don't move well. The joint doesn't move well, so you have pain. We cup it and we begin to pull all that back apart and open it back up. The toxins come out, blood and oxygen rush in, and what comes to the surface of the skin is the cupping marks. It's the waste that came from inside the joint. And you can see the cupping marks through here. These will decrease over the next probably day to 3 days. You can see that there was no real injury here because it hasn't marked, but there is injury here. There's injury up here, a lot of injury on the top of the knee, and then of course on the outside of the knee, there was a significant amount here. So I hope this helps you better understand what to do for knee pain. So from Brian Holloman at Revive Life Spa, thank you for watching this video. Have a wonderful day.